So we do several types of interventional procedures here. So we have educational materials on treatments for spinal stenosis, which can cause pain either in the neck and arm or back and leg. People can have arthritis of various joints in the pelvis, the sacroiliac joint, in the spine, these facet joints from spondylosis, or in the large joints, the hips, shoulders, and knees. So once these treatments resolve the inflammation, see, all of these conditions have two things that contribute. There's the underlying structural degeneration for both the joints and the spinal stenosis, which happens very slowly over years and months. And then at the time the pain starts, people have done something, usually new, often physical or strenuous, that develops episodes of inflammation. Then the narrowing that was previously there and the degeneration, along with the inflammation for all of these conditions, those two together causes the symptoms. So we can be very specific once we know what the source of the pain is to place the medicines, which are steroids, under x-ray guidance to resolve the inflammation and to resolve the pain. Now, these don't wear off. Once people are improved or healed, they would never have another episode of inflammation, never have recurrent pain unless they get a new episode of inflammation. Usually, if there's two strategies to prevent that, and many people never have pain again. The most effective strategies is a home exercise program where people can just do some stretching at home of selected muscles, and if they keep the muscles of the spine, flexible and limber, it takes the stress off the skeleton and much less likely to have recurrence. And there's no specific restrictions to activities, but often if people have recurrent pain, they did do something that caused it. So if they have an initial recurrence after healing, they're kind of learning what their limitations are. Often it's something physical. Many times people don't have to quit anything, like do yard work in 2 days rather than in one time. Be aware of body mechanics and positioning. But between the daily stretching and awareness of activities, people can live a long and fulfilled life and be very active without any pain.